After a very normal routine day, you go to bed and suddenly in the middle of the night you wake up with severe excruciating pain in your great toe, to the extent that you are not able to even bear the touch of the bed sheet. So this is a typical presentation of one medical diagnosis, and most often than not, if there has been no recent injury which you would attribute your pain to, the most often thought of complaint or diagnosis here is gout. So good evening friends, this is Dr. Mercy. I am a homeopath, consulting homeopath based out of Thane. As you guessed right, we will discuss today about gout, and we'll try to understand what gout is, how we can understand if it is actually the symptoms are indicative of gout, and what we can do to modify our diathesis of getting predisposed to a gout attack, what changes we can make in our diet, our lifestyle, and if not, if it is not curable, at least if we can have measures to treat it. So gout is one kind of it's called as a one form of arthritis. It's kind of an arthritis which is sudden. It does not grow over gradually over a period of time. It is sudden. One fine day you just develop symptoms out of nowhere. So first is it is sudden, and then it has severe inflammatory signs. Inflammation signs, as everyone knows, are redness, swelling, and pain. So these are the three signs which are accompanied by gout. The whole logic behind this attack of gout is there is increased uric acid production in the body. Now we'll understand in brief how, in a brief and a very coarsely manner, how actually the whole process pathogenesis happens. So urate crystals get deposited in around the joint. Now urate crystals have formed because there is increased uric acid than the normal range, and then uric acid gets transformed into urate crystals, and those get lodged into near the joints. Most probably the most affected toe joint is the toe joint. So what are the main symptoms of gout? It's like, first, it is sudden. It happens usually at night for some weird reasons, and also for some weird reasons it affects the great toe joint. Not necessarily only the great toe joint is affected, but there is a very striking feature here that the major joints of our system are not affected. The major joints in the sense, the shoulders, the hips, the knees, the ankles, these are not affected, but the minor joints, as in these metacarpal joints, the metatarsals of the toe, of the foot. Metacarpals are these of the hands, and metatarsals are of the foot. So these are the minor joints which are being affected by gout. Now what are the main causes of gout? Now there is, as I just said, it is increase of uric acid. So increase in beyond the normal range. Now our body does have a certain amount of uric acid in our body. When that level crosses the normal range, then the symptom starts appearing. So now there is a normal level of uric acid in our body, and that increase in uric acid happens mainly because of two reasons. First is either there is increased production in the body, or secondly there is decreased excretion from the kidneys. So that means the kidneys are not filtering enough of uric acid, and then that is why it gets built up into the system. Now once it builds up, then it is in the blood in increased form, then the normal range, and then it flows towards the kidneys, and then again the kidneys are backed up with increased uric acid already, and then the process starts piling up. So then the increased uric acid gets transformed into urate crystals, which are then lodged into the small joints. So this is how uric acid increase affects the, and triggers the process of formation of gout. Now urate crystals accumulate in the because of increased uric acid. Now what is uric acid? Normally body produces uric acid when it breaks down purines. Now purines are naturally found in our body. Purines are the building blocks of our DNA and RNA. What we might have heard in our days of college days, adenine and guanine. So adenosine and that sort. So these are the building blocks of DNA and RNA. So purines are usually normally produced in our body, and then purines also are in the form of food that we intake. So sometimes it happens that the food, the predilection to our food choices are such that normally body produces purines, and plus to add to that our diet is such that it is increasing the amount of purines, and then the breakdown, and then the uric acid. So then that is the point where we can have a control over this process. So understanding more about purines is, first thing, it is naturally in the body in the form of building blocks of DNA and RNA. Secondly, from outside we find that in foods what we eat. So what are those foods? Understanding that will help us reduce the intake of such food, and then that eventually helps us in controlling the increased production of uric acid or decreased excretion of uric acid in a broader sense. So the foods that are kind of having purines in them, firstly are seafood, and that too shellfish. So first thing is seafood. So kind of seafoods in which you have shells, like shrimps, and it's like any kind of a shellfish. It has more of uh, purines in it. Then comes in list is shrimps what we called is Columbi, and then anchovies in Marathi is mandeli, then sardines like tarli, then mussels, scallops, trout, tuna. These are kind of sources of purines from the seafood. Secondly, we also can get increased amount of purines when we eat organ meat, like red meat in the sense beef, lamb, and pork, or organ meat like liver or kind of veja, what you say is. These are the things which are attributed to increased intake of purine. Second thing which comes in my mind is alcohol intake. That increases the content of purines in our body in the form of like beer and artificially sweetened drinks, in the sense fructose. So these are the things which can predispose you if you are already having a uric acid diathesis. We call people, they have a diathesis. Diathesis is that tendency of a body to develop certain kind of an illness. Like in a subject or a cohort of 10 people, there might be 2 who would be predisposed to upper respiratory tract infections, like immediately with a cold exposure to cold, in the sense ice cream, or just sucking on that gola would give you bronchitis sort of symptoms. Then there might be 2 who are predisposed to gallbladder symptoms. There might be a bunch of people who would be predisposed to uric acid kind of. So this kind of a tendency where there is no logic, but your chemistry is made such that you are predisposed to particular kind of an illness, that is called as diathesis. So there are usually people who are more prone towards that kind of a disease. That is the basic idea of diathesis. Now normally uric acid dissolves in our blood and it goes to kidneys. Now from there the kidneys filter how much is required and how much is not required, what is in excess, and then it goes to the urine and then excreted from our body. This is the normal process which happens, but the body sometimes produces more of uric acid, or kidneys excrete less of uric acid, and then the whole kind of deviation from the normal cycle happens. So uric acid builds up as sharp needle like crystals, and then that gets deposited in our smaller joints, as I discussed earlier, not the major but the minor joints. Now the risks of gout are, what are the risk factors for development of gout? First thing, if you have diet which contains, as we discussed earlier, then your habits, like your alcohol intake or something like that. Then the second point is weight. Okay, then there is hypertension which is not treated, untreated hypertension. Diabetes mellitus is one condition which predisposes you to the risks of developing gout. Then heart and kidney diseases, obviously these are interrelated. Kidney disease, because then that decreases the efficiency of the kidney. Then there are some meds which actually makes us fall into that risk category of developing uric acid diathesis or gout. That these meds are such that baby aspirin. Like sometimes those are given as prophylactic for a patient who has already developed one stroke. So for prophylaxis we give a baby aspirin of 81 milligrams of aspirin a day. So baby aspirin is one notorious for causing that. Then antihypertensive drugs, which are diuretics, ACE inhibitors or beta blockers, these kind of medicines do predispose us to developing uric acid. Then family history of the gout, obviously we have a very there is always a strong factor of family history of any disease which predisposes you to a particular sect of disease. Family history of cardiovascular will predispose you to that particular kind of illnesses. So same way, family history of gout will predispose you to complaints of gout into your early kind of later stages of or approaching 40s. Then your age in the sense, we'll discuss age later. The sex predisposition is men are more predisposed to gout, and with respect to as compared to women. And if at all a woman is having complaints, then it is after perimenopausal or menopausal age, not within the childbearing age. It's very rare that women are seen to have been afflicted with gout. So men are the most troubled with respect to gout. That is the genetic the sex predisposition. And then there are some surgeries, traumas and vaccination which predisposes you for a gout. So what is the treatment of gout? First thing is that gout is not treatable. It is treatable. It cannot be cured. You cannot just cure gout. You cannot eliminate that tendency from your body. With respect to allopathic medicines, you can just treat it. You can treat that particular attack or bout of that particular gout attack. So the treatment of gout, as I said, it is a severe form of arthritis which has inflammatory changes. So the first line of treatment is anti-inflammatories. Anti-inflammatories, what they do, they reduce your pain, they reduce your swelling, and they reduce, obviously once the swelling is reduced, the redness is reduced. Okay, so these anti-inflammatory are the first line of treatment, and usually the attack lasts for 1 to 2 weeks. There is severe red and painful swelling of the joint, and you cannot sleep. It's horrible. It's throbbing pain. The treatment of choice in allopathy is NSAIDs, like non-steroidal anti-inflammatory disease drugs like ibuprofen or naproxen. Then there is one which is very specific to gout. It is colchicine. Colchicine, with it has that this particular drug has the kind of a thing that it has to be taken within the 24 hours of start of your gout attack. So colchicine is one such medicine which is indicated for gout. And then there are steroids, corticosteroids, which help in the management of that particular gout attack. So now uric acid reducing medicines are also used, and those are the purinols or allopurinol or the probenecide. This is from the allopathic point of view. Now lifestyle changes which will help in controlling or managing a gout attack is for very obvious reasons, diet which has low purine. So low purine diets, like foods which has less of purines in it. So top of the list comes yogurt, so low fat yogurt, then skimmed milk, obviously fresh fruits and vegetables are always a go, then nuts and seeds, then there is lean meat, chicken and seafood excluding the shellfishes and the ones which I just narrated. So to avoid things to avoid in our diet is obviously what I discussed are the causative factors of gout. So something which causes, if we avoid that, we are like kind of managing that particular illness. So avoiding organ meats, avoiding seafoods like shellfish, avoiding red meat, sugary foods and beverages, sodas, juices, bakery items, candies, alcohol, beer, refined carbs like white bread, pastas, cakes, processed foods like sausages, bacons and stuff like that. So uric acid, if we increase the excretion of uric acid from the kidney. So for that we have to, we need a good performing kidney function of ours. So plenty of water intake is advised to flush our urinary system or the excretory system. So increased water intake is a must. Now with respect to treatment of gout with homeopathy, there are very wonderful drugs which are tailor made for an individual, because every individual comes with a different set of symptoms. No two individuals are are the same. The presentations are different, the causative factors are different, the amelioration things are different, things which lower the pain, the aggravating factors are different, things which cause a worsening of the pain. So these are taken into consideration for homeopathic prescription, and we have very wonderful drugs. The indicated remedies for this are colchicum. This is the source drug which is which is used in allopathy, which is the colchicine. So colchicum, we used it in its natural form in a homeopathic potentized way, and it gives wonderful results. Then there is ledum pal, there is benzoic acid, then there is antim crude, when there are gout symptoms with associated with gastric symptoms. Then there is a medicine which is having uric acid with intestinal symptoms. So these are kind of combination of symptoms and the medicines which are indicated. Basically a homeopath will look for your individualization symptoms and prescribe you your constitutional along with indicated remedies for gout. I hope friends this short video might have helped you understand what gout is, and you would be in a better well placed to understand if someone from your near or dear ones are facing this, or you yourselves come up with such kind of a symptom. So do not get panic, and there are very simple things. Life doesn't go really complicated in day one. So all the differential diagnosis start from the ground level, and from the basics, and then when we rule out the basics, and then only we have grave things. So a sudden pain at night in your toe without any reason you can attribute, it might be as simple as gout, and there are many avenues for treatment. If you're looking for a real fix and a permanent fix, you can incorporate homeopathy in your life, and I bet along with your physical complaints, your mental health can also be fixed without any extra time consumption and much of a labor. That is the whole benefit of homeopathy and the miracle of homeopathy. You come for a physical complaint and your mental health is taken care of just like that. So thank you friends for being so patiently listening to the whole video, and I look forward to connecting with you with such information. Thanks a lot. You have a very good day and a very healthy week ahead. Thank you.